Welcome everyone. This is Perspective with Dr. Shah-Khan. I am an implant surgeon and dentist practicing in Chicago. So this is part 2 of my teeth whitening series. The first video was all about the science and background of teeth whitening, and this video is going to be a product review. I have a ton of products here. We have a lot to go through, so I'm just going to go ahead. So regarding the product review, it's going to be do's, don'ts, and hell to the NAWS regarding all of these teeth whitening products. Teeth whitening can be done for many reasons. People are insecure about having discolored teeth from, congenital issues, the use of medication, other issues, smoking, drug users. For whatever reason people want to get it done, it's all good. Let people live. Let them do what they got to do, So there are some great products out there which can help you achieve a better looking smile regarding your tooth color. And let's just go ahead and get into it. So the first I'm going to go over is rinses. So these are some whitening rinses. I'm going to just go ahead and put these, right there so you can see them. I went to Target. I spent $230. Here's my receipt here. That's kind of a lot, right? And I don't usually go into the oral healthcare section. I should. I'm going to, especially after doing all my research for this video, because there's just a lot of stuff out there, So this one's called Splendid White Whitening Mouth Rinse, alcohol free, so it's not going to sting. Let's look at the ingredients. So ingredients, when you read them, it usually goes from, so the first ingredient is going to be the most abundant to the least abundant. So that's just kind of how it works. So here, water, glycerin, hydrogen peroxide. So this is a definite do for me. This is the one I use. It's from Walmart. Equate, Whiten and Restore. Also has hydrogen peroxide, sodium fluoride. Fluoride is great, anti-cavity. I'll do fluoride video later. A definite do for me because this is what I use. Okay, so now let's get into toothpaste. You should be familiar with toothpaste. You should be brushing your teeth twice a day. If you don't, I kind of feel sorry for the people around you, especially ones that you're involved with, like that. I guess if you come to my office, I definitely got you. I'll just have to wear a hazmat mask, when you talk to me. All right, let's just go ahead and review these two. This is Crest 3D White Brilliance, and then this is Crest Whitening Therapy. Enamel care. I've used some of the Crest 3D products. Not really a big fan of them myself, but let's look at the ingredients. Sodium fluoride 0.243%. Sodium fluoride, so it's same active ingredient. They're the same, pretty much the same thing. Okay, so this one enamel care. This one has a sensitivity. Ingredient, which is potassium nitrate. So this has a form of that, I believe. These are fine. This packaging is obviously pretty cool. This is more my style than this. This is very Las Vegas, This is very New York, kind of chic and cool. So in toothpaste, you're going to have fluoride, obviously. They should have fluoride in them. So there's usually 3 forms of fluoride that's accepted by the FDA. It's going to be sodium fluoride, sodium monofluorophosphate, and also stannous fluoride. So these are just, they're kind of just different forms. For you, just make sure it has one of those in them. But they do come in varying levels. So I don't personally like these that much, but they're fine if that's what you want to use. Okay. So this one is Sensodyne True White. Toothpaste for sensitive teeth and cavity protection. Let's go to the ingredients. So it says active ingredients potassium nitrate, which is used for sensitivity. And, you know, I could get into it regarding like the exchange of ions, right? Like from the cementum and enamel layers, but I mean, I don't really think you care about that. You just want to know if it works or not. It definitely does work, and it's a do for me, especially after you get procedures done. Okay, so this is Rembrandt Deeply White and plus peroxide. I haven't used this personally. I may have used a sample, but I don't remember actually buying it. So this one has sodium monofluorophosphate, you know, which is like another form of fluoride, but it has it at like 0.9%. So this is definitely a little bit higher. And I think that, I mean, that's good. I think it's the highest one out of all that I'm testing. So this is a do for me. I don't use it, but you can. This one I love because I use this. This is like my favorite. Colgate Optic White. Advanced whitening with hydrogen peroxide to deeply whiten. It says whiter teeth. I have like bad posture now. Let me like adjust my chair. My mom would get really mad. Okay. So, yeah, whiter teeth in 1 week. Let's look at the ingredients. So sodium monofluorophosphate, 0.76%. So a little bit less than the Rembrandt, but still very good. A definite do for me. You know, the reason that I use Colgate is because my mom, I think, just brought Colgate products for us, like, you know, like growing up. Colgate's actually from Chicago. It's like a family. So I think like in the stores and stuff, they just probably had easier distribution, right? Because it was like local. But I like Colgate, so this is a definite do for me. Okay, so this is Tom's Children's fluoride free, so you know I already don't really like that. Let's go to the ingredients. Glycerin is the first ingredient, so that acts as a preservative in toothpaste. It prevents toothpaste from drying out and helps maintain its consistency. You know, like I'm just really not like into these products, and I'll tell you why. So in the last year of practice for me, definitely there was like some changes because I was kind of exposed to a different demographic and all of that. So I started treating like a lot of vegans, right? So a lot of my patients are vegans. And with that, a lot of them do not believe in fluoride. They believe in, you know, living fluoride free, and which is fine. You know, like I honestly, like however you want to live, like that's not my business. But, you know, if you have to realize that that's going to compromise your mouth. Like if you don't have fluoride, it's going to compromise your teeth. It is. There's nothing around it. And so like I had this one particular patient I remember, very, you know, fastidious, took care of himself, all that kind of stuff. And he was telling me he was a vegan and, you know, because he grew up a certain way and et cetera, et cetera. And I was like, all right, cool, you know. So then when I was doing my exam, he had 10 broken down teeth, you know, he needed 10 crowns and he needed like several root canals. So for business, I mean, that's great, right? I mean, that's a great day's work for me. And, you know, but the thing is, it's like the reason is because he just stopped using, you know, fluoride and fluoride products and fluoridated water and all of that. So anyways, you know, for me, you got to have fluoride. So this is a hell to the gnaw for me. Okay, so this is a new phenomenon now. They're two-step like toothpaste. It says Crest Brilliance, 3D White, and this is Crest HD. So for the first tube, the active ingredient is stannous fluoride, 0.454%. First ingredient, this one, stannous fluoride, same. And the second one, water, glycerin, hydrogen peroxide. Okay, so there is some sort of a bleaching agent. So these are basically the exact same. They're the exact same products, just different packaging. Let's see how much this was. I think it was like $15 something, $16, and this was like maybe on sale. One of these was on sale for $10, I remember, and then the other was like $15. You know, for me, this is a no, but I think if like you aren't going to the dentist for whatever reason, or you just don't want to, I think that it's fine. It's a decent alternative. It kind of reminds me of skincare. Like, you know, I go to a dermatologist, right? And like, you know, she says, you know, you have to layer your products. So, you know, first you cleanse your face, you know, you exfoliate sometimes, then you put on like a serum, and then you put on, you know, a SPF, and then a moisturizer. So this kind of reminds me of that. Like, it's a no for me, but I mean, I guess it's not like bad. It's interesting, actually. Okay, so charcoal powder, I don't have that. I don't want it either. You know, it kind of looks like, I've seen it on Instagram. It kind of looks like, you know, like Oreos in between your teeth. I personally would much rather have Oreos than charcoal. That's a hell to the gnaw for me. Oil pulling, also a hell to the gnaw for me. Coconut oil is good for your health, obviously, but you know, be careful. Don't have it excessively, because you know it's saturated fat, right? So you should kind of, you know, use it in your diet, but just like don't just have copious amounts, you know, every day. And okay, so baking soda and strawberries, that's something else. I know that's like Cindy Crawford's, one of her beauty secrets. I mean, you know, obviously she's a very kind of well-known, and, you know, very pretty, and she's from like Illinois or Chicago or something. But I wouldn't replace that with your toothpaste. ASAP Rocky, he's a rapper. He also uses baking soda, I think, before events and stuff, just to kind of his teeth look a little bit whiter. He also calls himself a pretty mother effer. He's like, pretty mother, you know, Harlem's what I'm repping. Like, you know, and that's cool. But, you know, I think to kind of replace your regular regimen just with strawberries and baking soda, I wouldn't recommend it, you know, as a practitioner. I look like alfalfa. Turmeric or haldi. So, you know, I mean, like, they've been using haldi in Asia, you know, particularly India, for centuries, for like all types of things. So, you know, you don't need to like tell me about haldi. You've been using it in food and salons and all that kind of tasty stuff for a long time. It's also an antiseptic, and it truly is a wonder. It's like a wonder spice, you know, but it does stain. It will stain your teeth yellow. If that's what you're into, by all means, like, do you, you know, but in terms of turmeric for teeth whitening, I would say hell to the no. So next, let's get into whitening trays. So I'm going to do drugstore first, and then we'll go ahead. Oh, this was like the haldi. I just grabbed it from the cupboard here. I'm really tired now. So here's some whitening trays. This one says $20. I got a $2 coupon. I asked if I could keep it, you know, just to show you guys, and she was like, no, you know, like, we got to get our money from the manufacturer. And I was like, all right, girl. So the ingredients here: PVP, water, PEG 8, hydrogen peroxide. So PVP is polyvinyl pyrrolidone. It helps keep, you know, it kind of helps keep new stains from adhering to teeth. PEG 8 prevents water loss. Hydrogen peroxide, which you know is a bleaching agent. I haven't used this one. I used to use the whitening strips. Mine were the one I used from Walmart. I used them in college. They were good, you know. They work, but you just have to use it kind of over time. That's when you're going to see a difference. So this is a yeah for me. Okay, so this is Crest 3D white strips, glamorous white. That is the claim, or the name, the claim and the name. Yeah, and then this one is Crest noticeably white strips. Let's go to the ingredients, you know, because I'm a doctor. Ingredients: water, glycerin, hydrogen peroxide, So same water, hydrogen peroxide. So, I mean, these have the same active ingredients. This is $35 though. This was like 20 bucks. You know, they also come like different amounts. So this one has 14 treatments, which is legit. This one has 10 treatments and this one has 7. So keep that in mind. Be cognizant of that when you're shopping for these products. I wouldn't use it because, you know, I have access to better things. But if you don't, go ahead. Okay, so these, which one should I do? Okay, I'll do this one. Okay. So this is Venus White Ultra. This is 11.2 hydrogen peroxide. This is doctor grade stuff, so you're not going to be able to buy this at the store. I used only one of these. I was gifted this actually. I don't know if these are samples, but I was gifted this by a supplier. I tried them once, not really into it. The solution kind of got all over my gums and it was messy and they were really small. So I just didn't like it. It's a no for me, but you know, it is powerful. It has a high percentage of hydrogen peroxide. So, okay, so now these are opalescence trays. This is the upper, this is a lower. I got these when I was doing an orthodontic internship in dental school. They were just samples. I used them, they were good. I didn't use too many of them, but they're definitely effective. In the office, we have a system called Opalescence Go. So they're trays and you know, you take them home and you can just use them. They're good. I like Opalescence by Ultradent. It's a good company. So this is a definite do for me. And that concludes our product review video. I hope that you enjoyed it. I hope that you learned something and that it helps you kind of on your journey for health. So make sure you like, comment, and subscribe. Share the video with all your friends. You know, leave some comments on you know, stuff that you want to hear about. And you know, I'd like to leave you with something. You know, if any of you are going through anything, I certainly hope that things will get better for you. Just remember, you know, if you have your health and your freedom, you're better off than a lot of people in this world. So take care, and I'll see you on the next video.